My name is Dr. Mukadam. I'm the GP here, and I understand you've come for your COVID vaccine today. Is that right?
Yes.
Inside the South London surgery, the first GP practice vaccinations were getting underway. Outside, the virus was continuing to wreak havoc.
Secretary of State for Health, Matt Hancock.
The news that Greater London, parts of Essex and Hertfordshire are to be placed into Tier 3 came as no surprise, although the disappointment was palpable.
Our NHS is straining every sinew to cope with the pressures, as they always do, but if cases continue to double, even they will be overwhelmed. So we must act now to shift the curve, because when the virus is growing exponentially, there is not a moment to spare.
More than 10.8 million people in this area will be affected from just after midnight on Wednesday until it lifts on December the 23rd to allow people to form Christmas bubbles. This now brings the total number of people in England in Tier 3 to more than 34 million.
The increasing areas are rising faster than the decreasing areas are falling. And as things stand, we are heading into the Christmas easing with diminishing headroom. The buffer zone these tiers were supposed to provide is getting much thinner.
From Wednesday, food and drink venues will once again become takeaway and delivery only. There'll be no mixing indoors or in most outdoor venues except with your household or your bubble. Although shops, gyms and beauty salons can stay open, and people will be encouraged not to travel outside the tier. In November, London had the third lowest regional rate, while Yorkshire and the Humber recorded the highest. Now they've swapped places. And one cause, the Health Secretary said, could be a new strain of the coronavirus identified in southern England.
Over the last few days, thanks to our world-class genomic capability in the UK, we have identified a new variant of coronavirus, which may be associated with the faster spread in the southeast of England. Initial analysis suggests that this variant is growing faster than the existing variants. We've currently identified over 1,000 cases with this variant.
It is still unclear, though, whether this variant is having an impact.
It does appear to be in an area of the country, particularly Kent and bits of London, which are increasing rapidly. Now, we don't know what's cause and effect. Is it getting more frequent because it's in a part of the country which the rate of increase is going faster anyway, and therefore inevitably it's a higher proportion? Or is it that this virus itself is possible to transmit more easily?
Cases of COVID-19 are rising across the age groups, but in Wales, classes went online today and a number of schools defied England's government with plans to do the same. But the good news is the vaccine. In Scotland, they began giving it in care homes.
You relax your arm for me. That's it. Sharp scratch.
In England, vaccinations in those 80 and over and care home staff were able to start if they could get to the GP surgery. The logistics are enormous, harder than in hospitals because they don't have the fridges here to store the vaccine at -70. So once it's thawed, it has to be used within 5 days. At this surgery, they think they can do about 300 patients a day. And then they have to find room for them to wait for 15 minutes in case of an allergic reaction. So they need more space. How are you going to cope?
So it is incredibly challenging. I kind of call it a quadruple threat of, not only business as usual winter, our busiest time, also our flu immunisation campaign is the largest that we've ever had. There's COVID, it hasn't gone away, of course, and then there's a COVID vaccination program, which is the largest of its kind, completely new service. So everyone on the ground here, from GP practices to GP providers, are all pulling together to deliver against those risks.
It's 28 days between the first vaccination and full protection, with 2 doses needed, and in between is Christmas. It would be unfair to blame the turkey, but in the US, infection rates and deaths have soared after the Thanksgiving celebrations, and here there are fears that the 5 days of Christmas granted by the government will see a similar surge.
Well, let's talk now to 2 professors. They're both from University College London, and they are both members of the independent SAGE group. Dinan Pillai is a virologist and Christina Pargel is a health research mathematician. Welcome to you both. Let me start with you, Professor Pillai. This new strain of coronavirus, which Matt Hancock, the Health Secretary, mentioned in the House of Commons today, almost as one of the justifications for going into Tier 3 in London. How seriously should we take it? How dangerous is it?
Well, hi. I think the operative word that Matt Hancock used was it may be associated with more transmission, but equally it may not be. And Chris Whitty, that has just been on your piece, I think quite rightly said that it's quite difficult to distinguish between a virus that is transmitting more with a virus that happens to be in a community where there are more transmissions. And so this needs a lot of work to tease those two things out. But I should say that all viruses, and COVID-19 is no different, do develop mutations, therefore variants develop, and at any one time within the UK, there are a number of these variants transmitting. And so it is not unexpected that you get these surges of different variants over time. We remain to be, convinced actually that this is at the cause of the increased transmissions we're currently seeing in London and the South East.
So given the fact that the science on this new strain is so nascent, should Matt Hancock have mentioned it at all?
It's a rather strange way to report key scientific findings, and the virological Twitterati are at really play at the moment in terms of transferring information, what is known. But I should say that we're really fortunate in the UK to host the COVID Genomics Consortium, COG UK it's called, which is the largest initiative of its type in the world. And therefore we're really well placed to be able to monitor the strains of the variants of viruses that are transmitted, and also to check things like whether they would still be susceptible to vaccines and drugs as they're developed. So I think we can be reassured that we're in a much better place than many in the world with regard to these continual changes in the virus.
But just briefly on this, one more. It's going to be all over the front pages of the newspapers tomorrow. It was in our headlines tonight. There will be many people who, read the words new strain of virus of COVID-19, and they're going to be alarmed. Literally in 10 seconds, should they be alarmed, yes or no, tonight?
They should be as alarmed as for COVID-19. And the key message is that the mitigation in place, in other words, social distancing, remains exactly the same for this virus. This is the way that we're going to get out of the pandemic, pending the vaccine being rolled out. Okay,
Christina Parger, let me turn to you. We've talked about this many times before, and I've tried to get you to kind of explain the logic, the science behind these new measures. So London will go into Tier 3 tomorrow at midnight, which means no hospitality, but you can still go to shops to do your Christmas shopping, I gather. And at the same time, of course, we are going to have what they call Tier 0, which is everyone, 3 bubbles mingling over Christmas. I'm sorry, but it doesn't seem logical to me that you can have Christmas, but you can't go to a pub or a restaurant in the run-up to Christmas.
They're two different things. Moving up a tier is because cases have increased, over 30% in London in the last week, over 30% in the east of England and southeast. So, something has to be done there. Shopping is safer than hospitality because you're wearing a mask and you're generally not talking, at least not as much as you are in a pub. Christmas is a really difficult one. And I think what has to happen is the government has to kind of change its messaging around and say, just because you can mix with up to 3 households doesn't mean you should. And everyone needs to kind of think about this, their own situation, their own families, and think about how dangerous am I to my family members? Okay. And that's a really unusual thing to do. It's really hard to think of yourself as a danger, but we're all a danger to each other. And the government needs to put out the messaging about how do we make those decisions that outdoors are safer than indoors, shorter duration is safer than longer duration, all of the little protective behaviours we can do to try and stay as safe as possible at Christmas. But yeah, the safest thing is not to see each other. Okay, the other thing I don't understand is if it's safer, to go shopping than to go to pubs. The way you've explained it, it makes sense to me. But what about kids going to school for another week? We know that, the virus is rampant in many schools, that kids are spreading it even if they don't get sick from it. Surely that doesn't help either. Kids in schools, it isn't just a question of are they spreading it. Yes, there is transmission within schools, but there's also education within schools, and that's incredibly important. I think that if families are in a position to isolate for 10 days before Christmas, they should be allowed to take their children out of school without penalty. But not all families are in that position. And there are many families in more deprived areas, particularly, who cannot work if their children are at home. And that's also a factor to consider. So it's about, how do you support families to make the right decisions for themselves? How do you support schools? How do we make schools safer? And none of that has really been addressed. And even if we don't address it right now, this week, we have to address it for January when children go back to school.
But we're talking about a few days here at the end of term that could make a huge difference to the general infection rates that will be spread in the Christmas period when all the, when the three bubbles interact with each other.
Yeah, I mean, it is a few days. And as I said, if people are in position to isolate, then I think they should be allowed to take their children home from school if that's what they choose to do. I still think people shouldn't necessarily be meeting anyway if they have teenage children with more vulnerable family members. And the other thing with schools is, yes, they're part of transmission, but it's not just schools. I mean, many places in England went down during lockdown. London didn't go down that much. Schools were open everywhere. It's that schools are also reflecting the community transmission that is around them.
Okay.
So they're a factor, but it's certainly not a magic bullet that if you close schools, suddenly everything is going to drop.
All right. Dina Pillai, just one more to you. I mean, I think you've referred to it earlier, but let's just spell this out. The fact that there is a new mutation of the virus here, we don't know, as you said, how serious it is yet, and we're still watching it. Does that put the vaccine into some kind of trouble?
My understanding is that this particular variant does not compromise the vaccine efficacy. However, we know from other viruses that viruses do mutate, they do evolve, and they can render, for instance, drugs as less effective. And for that reason, there needs to be monitoring. And as I mentioned, we do have a very good monitoring system in the UK, which itself has identified this particular variant. So we need to maintain that surveillance. It's a really key component of our overall response to the pandemic. But as I say, at this stage, there's no indication that the vaccine is rendered ineffective by this particular variant.
But it keeps dishing up surprises, some nasty, some less nasty. OK, got to leave it there. Dina Pillai, Christina Pargle, thank you very much indeed.